Psychiatric medications when you are in an abusive relationship. This is one thing that is a sensitive topic, but I think it's important to talk about. If you have never been diagnosed with a psychiatric disorder before you were in your abusive relationship, and either your partner is pressuring you to go and get evaluated, or you're thinking that in order to survive, I am going to have to go get on medications, I just want you to pause before you go. These abusive relationships can lead to depression, anxiety, PTSD, and all of these things. But what my concern is that we would use psychiatric medications to dull the anger and the intensity of the emotions that you would need in order to propel yourself to stand up for yourself and to leave these relationships. Now, if you are experiencing suicidal ideations and you do need medications to help you to manage this, because an abusive relationship can get you to this point where you are feeling so depressed and so down that you are having these symptoms and these feelings, absolutely. But this needs to be a big red warning sign to yourself that this relationship has led you to this point where you are feeling so down on yourself that you feel like you no longer want to be here. So, I caution you on also allowing someone to tell you that you are crazy. First of all, they're making you feel like you are, but then, hey, I think you need to go to the doctor and go talk to someone. Get a diagnosis, get on some medication, instead of them making the change that's needed in order for this relationship to be healthy. I know that this is very difficult. This is very touchy because there is. Sorry, I had to move my car. Someone pulled up next to me to get groceries. I didn't want to see me talking to myself, thinking I was crazy. There is so much at stake here with, first of all, if your partner wants you to have a diagnosis, wants you to be on medication, they can have a lot of gains in being able to further be the victim. Oh, my partner has so many problems. They're on medications for psychiatric disorder. Feel so sorry for me. Right? And then, unfortunately, this can be used against you later. And I want you to be this is why I want you to be very careful. Now, I don't want you to think I'm anti-psychiatric medication, in no way, shape, or form that I am. But I have a story. So, when I was married to my ex-husband, I had never been diagnosed with any psychiatric disorders before. But the abuse that I had been enduring by him for several years at this point, I ended up in a psychiatric room. I was having suicidal ideations, homicidal ideations towards him, and they discharged me because I was like, look, I know that this is stress from just stress, because he was there in the room, of course, monitoring everything that I said. So I ended up seeing a psychiatrist, and with him in the room again. And she diagnosed me with bipolar disorder. I do not have bipolar disorder. Never before in my life or after in my life since being with him have I ever had bipolar symptoms. But it was these episodes that I was having based on the severity of the abuse that I was experiencing. And she did prescribe me lithium because she was like, are you feeling this? Are you feeling this? Are you feeling this? And I was like, well, yeah, I feel like I am going through these waves of rages. But my body needed that in order to propel me to make change. It was giving me energy to say, I'm not going to deal with this anymore. But instead of listening to it at the time and letting it help me to get out of there, I instead began taking lithium to deaden what my body was trying to help me to do, which was to get out of there. I took it for a couple of months, and then, thank goodness, the logical side of my brain went, no, this is not what you have. I began looking into it, researching it. I was going to a counselor. She was the one, if you watch my pinned story, who helped me to become the therapist that I am. She was like, I don't think you have bipolar. I was like, everything that I'm reading, it doesn't make sense either. But I was beginning to deaden my entire system. So that way he also then had a psychiatrist's notes to go and pull when we went through a divorce to say, oh, see, she's crazy. She shouldn't have her children. And I'm not saying bipolar disorder means that you're crazy in any way, shape, or form, but that's what he was claiming. And I want you to be very, very careful Okay, if you have the symptoms, absolutely go and take care of yourself. Take the medication that will help you. Absolutely, these medications can be wonderful and can help you if you absolutely have this. However, if these symptoms began after you were in this abusive relationship, it could be that your body is trying to help give you what it needs to get out of there. It is warning signs, it is red flags of what you are experiencing. And your body is trying to tell you, this is not good. This is not right. Please listen to me. I am trying to tell you it is time to go. And we don't want to deaden what your body is trying to tell you. So that is my soapbox about psychiatric medications, and trying to deaden what your body is telling you need. Absolutely, though, if you're starting to have suicidal ideations because of this, which I also did, and I did get on antidepressants and was on those for a couple of years, as I was getting out of and trying to leave this relationship, because I knew that I was not safe. And then when I was out of the relationship, I was able to get off of them and have never been on them again since. So I just want, please just be careful that they are not getting any secondary gains from you having a diagnosis, and that you are not medicating yourself for something you don't have. All right, everyone. Have a great day.